Hey, Dr. Giganti here, and in an effort to make our office even more of a safe environment, we've now had a tailor's make fabric mask with a microfiber on the inside, and these are being distributed to all patients upon entering the office. We ask patients to, once they're done with them, to drop them into a bin to be sterilized. We have reduced our patient load to a very safe level. There'll be a significant amount of safe space between patients. We have air purification systems. We are wearing gloves and masks, and prior to seeing any patients, all tables are cleaned with Clorox bleach and so forth. We do ask you that if you do feel you're not well, to notify us and not come in. However, we are open. We're still maintaining our extended hours, not to compress the patient and keep the patient base spread out as much as possible. So we're here to help you. Give us a call if you need us. We've, in order to try and help our patients more stay free of any danger, we're actually having a tailor-make face mask. They're fabric with microfibers. We've got as many specs as we could to make them as good as possible. We recommend patients wear them throughout the day, if they're especially in crowded areas when they come to the office. And at night, you can wash this with soap and water. Well, that's your phone. You can wash it with soap and water. Mm-hmm. The way it goes is you bring both. You see this little thing for your nose in here?
Yeah.
You put both straps over your head. Mm-hmm. Right. Put it down. Over your nose. This one below. And then you give this a pinch. Okay? And that's how you wear it.
Yeah.
Okay, at night you wash it, soap and water, hot water, and then just let it rinse it. We wrap it in a clean towel, wring it out, and let it air dry. Okay? And then when you're not, you can just bring it down there.
Okay.
And that's yours. You gotta take care of it.
Okay.